The next question comes from Jose Somalo at HOY in Delaware newspaper. Is Delaware going to be able to perform quick coronavirus tests, which may help to understand the real extent of the crisis? They believe that with the lack of proper testing in the Hispanic community, the virus will be undetected for some time in Delaware's kitchens, production facilities, construction sites.
So one of the things that, one of the positive things coming out of our meetings with the hospitals, Dr. Rattay mentioned that the hospitals are really the ones that are providing the community testing in their 7 sites across the state, Newcastle County, Kent County, and Sussex County. And so they use their own resources for doing that. Some of those are through commercial labs, and the turnaround time for a test at a commercial lab has been quite a few days, more than a week recently. Our turnaround time for the public health lab, and those tests are, and I'll let Dr. Rattay comment on this, those tests are kind of reserved for people who are sick and ill and first responders, so we know that we can, healthcare providers, so that we can get those people back in line. But we are optimistic. There have been some breakthroughs in terms of the equipment used by Christiana Care and hopefully by some of the hospitals downstate, that they'll be able to do the testing in-house and turn them around on a more timely basis.
Yes, I mean, our testing access has increased slowly. The hospitals have been amazing partners in this. As far as rapid tests, we do have some rapid tests that we hope are going to make it into Delaware in the next 24, 48 hours, if the FDA will release them hopefully soon. Those will enable us to get quick testing done, for example, if we're concerned about an outbreak in a long-term care facility, or to be able to test individuals to triage them as they arrive at an emergency department, or healthcare workers to help them get back to work. So those are going to have an important role as a part of the overall testing strategy. But we're all looking forward to the time when these supplies are more accessible, more predictable, and our testing is quicker.
We did have a positive meeting the other day on testing, in which each of the hospitals indicated that they had at least a number of tests, given their current utilization rate, to take us 2 weeks into the future, and the possibility of getting the rapid tests and being able to do the tests in their own labs, which will shorten that turnaround time considerably.